Misho erikumanywa nka refractive errors nemwe ekyereze yo kuremesa abantu kwezaje kandi egi nekitangira abana okushoma okuhandika kano kora jo mbibina okucondoza nukoreka ngo bucweka 11 n'ubucwanyagurika mukaga bw'abana bari kushoma nibaba bino burwirobo.
The studies that have been done among school going children indicate that 11.6% of them have actually refractive errors. And with the rapid assessment of avoidable blindness that have been done in the two regions of southwestern Uganda and northern Uganda, whose figures you can extrapolate to this place, indicate that over 60% of the population have refractive errors.
Dr. Kasese ayongere yashobora ngo burwiro bwa butajanjabirwe nubasa kugemesereza abana ku rugo mu mashomero ahabo kuba nubaremesa kwatagana byo bwegese.
If you're not careful with those children, then they can easily lose interest and hence drop out of school. The other form they usually have is short-sightedness, myopia. That one, if not corrected, makes it difficult for them to copy notes from the blackboard and to see what the teacher is teaching.
Kasese district neshweka kimwe ekibashangire mu buzubo burwirobo kandi abana bakwasibwe n'aba primary obundi n'abarukuzo musiniya.
Eye problems are mostly in young children beginning with P6 up to P7, and they are more serious when they are in secondary. But in primary, if not detected early, they can proceed to secondary when they are being treated as normal diseases and cause more harm to the eyes.
Dr. Vayera Alunga yayongera yashoborera ngo buzubobu nubwetaga man mengi aho kugira ngo abantu bamwe batura nabwe kandi batari kukimanya.
Eye diseases have been known for the elderly, but we are talking about someone who is very young, in his early 40s, going completely blind and irreversibly. But that is a key misconception of thinking that eye diseases are for the old. No. From a newborn who can be born with an eye issue, it goes on through primary school. We have seen that it's responsible for a number of dropouts and poor performance in schools. And then, of course, the teenagers and the workforce. And finally, back to the elderly, from whom many think that's what the eye diseases care for.
As we are working through the local government, we are using the community health workers that are going to be conducting the door-to-door. In other words, we are building the village health teams or community health workers in capacities of conducting eye screenings. That is one, and the other is that would want to reach out to as many people as possible, because Kasese is one of the biggest districts in Uganda.
Kato Habat or inspector amashomero mu Kasese yagerango obwiro bwinji abantu mbyaro nibagerango buno burwire bwenzarwa kandi bari mu kutwara abana babo mu marwaro ekiri kubarigeraho buzuvu.
Sometimes they drop out because of lack of treatment and also being provided with glasses. And in schools that are in villages, it is more worse than those in urban. And village schools, they assume as if it is a cultural problem, where parents said they are bewitching my child.
Gasha kwa Muhindo Gerard wa Sky TV ya Genshonga.